All right, we'll be presenting our PowerPoint on methylphenidate, also known as Ritalin, by Alicia Torsky and Brianne Golden. The generic name is methylphenidate, and you can see the chemical names listed there. There are several brand names depending on concentration, whether or not it's long-acting or short-acting. Some of the examples that are given are Ritalin, Concerta, Quilivant, Methylphenidate, and Daytrana. The medication effects, it improves attention, focus, and impulse control. Some of the common adverse effects are appetite loss, increased heart rate, anxiety, and insomnia. Some of the more serious adverse effects are hypertension, cardiac arrhythmias, tics, psychiatric symptoms such as mania and psychosis. Some precautions to take while on this medication is if you have a cardiovascular history, psychiatric disorders, or a history of substance use disorder, because this is a controlled substance and can become addictive. The dose, route, and frequency, the typical pediatric dosing for ADHD is 5 milligrams twice daily, and then you kind of increase the dose gradually. There's an oral route that can be found with tablets, capsules, and liquid, and there's also the transdermal route as well in the form of a patch. And you take it 2 to 3 times daily. It is a pregnancy category C, so that means that animal reproduction studies have shown adverse effects, but there's no adequate human studies, so only use if the benefits do outweigh the risks. It's a central nervous system stimulant, and it's a Schedule II controlled substance, so it can cause abuse and dependence.
Originally, the drug was developed in the 1940s and approved by the FDA in 1955. Initially, it was intended to treat chronic fatigue, depression, and narcolepsy. Since then, it has evolved towards treating ADHD and narcolepsy currently. Since 1944, methylphenidate was first synthesized by chemist Leandro Panizzi, sorry, I butchered that name. 1955, FDA approved Ritalin for use by Ciba, now Novartis, in the 1960s to the 1970s, it was increased for use for hyperactivity in children. In the 1990s, a surge in ADHD diagnosis and widespread prescribing. Currently, Ritalin is still being used widely, but exists alongside other formulations like Concerta. There's some off-label uses. Sometimes it's used for treatment-resistant and depression, fatigue and oncology patients, certain cognitive disorders such as post-brain injury or narcolepsy-related cataplexy. There's some special considerations you need to take into effect with this medication. High-fat meals may decrease absorption, and you want to avoid alcohol with it. With children, you want to monitor their growth, as this can decrease weight gain in their normal growth patterns. You want to monitor your blood pressure and heart rate, and then you also want to monitor any mental health changes that may occur. You want to call your provider if you experience any chest pain or shortness of breath, hallucinations or severe anxiety, any marked changes in mood or behavior, or a skin rash, primarily while using the patch.
In the study that I found by Storbo, evaluated if methylphenidate improves ADHD symptoms in children and adolescents, and they wanted to determine its impacts on adverse effects, behavior, and quality of life. They did a systemic review and meta-analysis with randomized clinical trials. They did the study on children less than 18 years old with normal intellectual functioning. And then they used methylphenidate versus the placebo versus no intervention at all, and used teacher-rated ADHD symptoms and serious adverse events. What they found is that teacher-rated methylphenidate may improve symptoms versus the control subjects, but there was no definite difference in serious adverse effects between groups. There was a slight difference in mild adverse effects, the most common being sleep concerns and decreased appetite. And there was a possible improvement in behavior and no change in the quality of life. So in conclusion, methylphenidate may reduce ADHD symptoms, but results were not definitive in this study. So there was no increased risk of adverse effects, but mild side effects are common.
Another study that we looked at was completed by the National Journal of Psychiatry. What they wanted to determine is methylphenidate remained effective after 2 years of use. The age of the subjects was from 3 to 18. They did a double-blind continuation of treatment for 7 weeks at a time, where they would either prescribe the actual medication of methylphenidate, or they would wean somebody off of methylphenidate and put them on the placebo. What they found is those receiving methylphenidate had a lower hyperactivity level by almost triple the level versus those who had received the placebo. And their conclusion is the long-term methylphenidate use is effective for those with ADHD, but continued effectiveness needs to be reviewed by your doctor, because it is on a base-to-base person, and everybody can change throughout the year. So they kind of, again, like Brianne said, everybody's a little different, and kind of based on all that. With the ethical considerations for this group study that they did, participants, and I say or guardians because most of these participants were under the age of 18, were given the option on whether or not they wanted to end the study at any point in time. They could choose whether or not they wanted to receive the placebo. So their parents could determine if they wanted their kid to continue to receive the methylphenidate continuously, or if there were some parents who were skeptical and wanted their kid to receive the placebo because they did not think the methylphenidate was effective. Everyone was provided with risk and side effects, and what would happen if they were to stop the medication suddenly. They were provided with how to taper off the medication as well. The FDA label use. Methylphenidate is approved by the United States Food and Drug Administration for treating attention deficit hyperactivity disorder, or ADHD, in children and adults, and is a second-line treatment for narcolepsy in adults. Children receiving this medication should be 6 years or older. Methylphenidate therapy for patients with ADHD and narcolepsy leads to significantly better outcomes when supplemented with non-pharmacological therapies such as social skills training for ADHD or sleep hygiene measures for narcolepsy. And then they list also off-site subjects of which this medication can be used for as well. The length of time for this treatment was for 2 years in total. Steps of the process would be anywhere from 7 days to 2 week periods.